Hello, everybody, and welcome to Humanist Canada's webinar series. My name is Anna Popovich. I'm Program Director with Humanist Canada and your host this afternoon. You're attending in listen-only mode. The webinar is going to be 60 minutes in length with time allotted for Q&A at the end. If you have questions, please submit them with the Q&A tool at the bottom of the screen, and we'll address them at the end of the presentation. You can also upvote a question to move it up to the top of the list if you like it. Our topic today is strategies in reproductive health activism, and this is our second webinar in the three-part series on reproductive health. Our guest today is Dr. Teale Bondaroff, a researcher and community organizer with a PhD in politics and international studies from the University of Cambridge, and the 2 BAs in political science and international relations from the University of Calgary. Teale is the research coordinator for the British Columbia Humanist Association. He is also the director of research for Oceans Asia, a marine conservation organization based out of Hong Kong, as well as the chair and co-founder of the AccessBC Columbia Campaign for free prescription contraception, and the volunteer member of the board of the Great Victoria Placemaking Network. His academic research focuses on the strategic use of international law by non-state actors. So sounds like you're a very busy past person. Welcome, Teale, and thank you for joining us. Over to you.
Yeah, thanks for having me. Well, good afternoon or morning, depending on where people are today. And I'm going to jump right in. I'm going to share my screen because I've got some fun slides for folks here. There we go. Brilliant. We have a lot of stuff to cover. Very briefly, if you're welcome to tweet at me at TealePB. And if you're interested in learning about some of those other projects that were just mentioned, you can visit my website at teale.ca, where I collect a whole wide assortment of different projects that I'm working on. And yes, I do lots of different things. These are some of the organizations in which I'm involved in. And today we're talking about strategies in reproductive health activism. What I'm going to do is I'm going to give a general overview of activist strategies. It's something that I've been studying for quite a long time now, more than 15 years. And then I'm going to dive into two different kinds of campaigns. An insider campaign, the campaign that myself and our amazing team with AccessBC ran here in British Columbia for free prescription contraception. And then I'm going to talk about a classic outsider campaign, Women on Waves, which is a fascinating organization that does everything from delivering abortion medication by drone to abortion clinics on sailboats. And if I have time, which I doubt, I'll get into a couple of emerging issues that present some challenges around effective strategies for addressing them, crisis pregnancy centers and maternity homes. And let's jump right in. So, and by the way, this is important stuff, right? We do live in dark times. There was a slightly reassuring change in the United States with their new government, but they are still, they still have a Supreme Court that's packed with regressive folks who believe in forced birth. And we have countries like Poland that are slowly being taken over by Catholic fascists who are degrading and eroding women's rights and people's reproductive rights in general. And so generally speaking, reproductive health activism can take lots of different forms, right? It can take the form of a simple letter writing campaign or, fighting in the streets with Polish stormtroopers, as it were. And so when we talk about activist strategy, there's a lot of broad content we could cover, and there's been pages and pages written about this. But generally speaking, we have this wide range of strategies. And my general piece of information, advice for folks is to select the strategy that's going to help you achieve your goal, to help you achieve your objective. We often have a tendency to reach for strategies we've used in the past, strategies we've seen other people use, or strategies that might be the most fun. But if you desire to actually achieve your goal, the best piece of advice that I have is to ensure that your strategy is the most effective at letting you achieve your goal. Of course, depending on various other factors like the situation, the political opportunity structure, how much money you have, how many people you have, and the situation around you. And this also doesn't mean that there can't be space for diversity of tactics, right? Some folks are willing to sit in a tree to protect a forest for 2 years. That just may not be an option for everybody. But when you're selecting a strategy and the tactics that follow from that, it's important that those strategies directly fit the goal that you're trying to achieve. And very often folks will do what previous people have done. And that makes sense, right? We should be looking to past campaigns to develop our strategies, because past successful campaigns will have lots to teach us, and past failures will have lots to teach us. And we also, you can see the transmission of tactics between from different generations of activists and also across issues. One of my favorite examples are Earth First and early confrontational environmental activists took a lot of inspiration from the Wobblies and the International Workers of the World, radical trade unionists. So you can see this transmission of ideas over time. But generally speaking, I like to have people spend their time fighting to make the world a better place with strategies that will actually work. Activists have a huge toolbox of tools that you can pick from. You've got this broad spectrum ranging from, on one hand, signing a petition or changing your profile picture on social media, to writing an angry letter, to protesting in the street, to blockades, to armed insurrection on the far side. And all of these tactics, all these strategies have a time and place, and all the tactics have a time and place. And you should reach for the one that's most likely to help you achieve your goal. When I'm talking, I'm going to try and avoid some technical terms, but there's a couple of key terms I wanted to flag for folks, just so they're aware of the kinds of concepts we're talking about. And I promise we'll get to the fun stuff about abortion pirates very momentarily. This is the fun boilerplate theory stuff. But you have your goal. That's what you're trying to achieve. Ideally, it's clearly stated. The more concrete, the better. If your goal is just to raise awareness, that's fantastic. But if your goal is to achieve a specific policy outcome, you're more likely to know when you've achieved your goal, because you can always raise more people's awareness. Strategy is the overarching way you're going to achieve that goal. And I'm going to be giving some examples today about different kinds of broader strategies. And the tactics are the implementation of that strategy. And these are the various steps that you take along the way, the various ways that you adjust and try to implement your strategy. Tactics change a lot. Strategies tend to remain mostly fixed, and your goal should try to remain fixed. Although if you're successful, you can always expand your goal to other things. And the last technical term which I'm using, and this is borrowing from some political science literature, is the idea of political opportunity structure. This is sort of a nebulous term, and different scholars have tried to tackle it in different ways. But basically, it's the situation you're in, where you're at. And that includes everything from the country you're operating in, the type of government you have, the amount of resources that you have, general things like cultural values, the resources of your opponents, the history of past campaigns, basically all these different factors. Now there's stable ones, things like your government type, constitutional laws, things like that. There are more flexible ones, and I think the most thing that we can all probably think about these days are things like pandemics, unexpected events that occur that might throw your campaign into a bit of a loop. And also, things like elections. And some of the stories I'm going to tell you about momentarily have some fun twists and turns along the way, unexpected characters that make interesting appearances. And generally speaking, when you're setting up a campaign, you want to look at the situation you're in. Right. Some countries have really good political systems that allow citizens to interact with their governments in a constructive way. Some countries don't. Sometimes the community, the public, is not ready to hear a message, or the political system is not set up to accommodate that message. Other times it is. So one of the best things you can do before you start a campaign is to survey the turf, see what the situation's like on the ground, and then start developing your strategy to allow you to achieve your goal, but at the same time, to make sure the strategy fits with where you're operating. So this is a very broad generalization, but two broad kinds of campaign strategies: insider and outsider. Now, when we're talking about insider campaigns, and these are, by the way, will all become very clear when we start going to the examples, but insider campaigns tend to engage directly with institutions like governments and things like that. So you might create a think tank and develop research input. You might run for office. You might engage in conventional lobbying. On the outsider side of things, this is when you either work outside of institutions, against institutions, or independent of institutions. When I talk about institutions, I'm talking about international organizations, governments, structures like that. And this involves a wide range of things that include service provision. So you might just go ahead and do something like opening your own hospital ship. If you're working locally and you believe in education, maybe you open your own independent weekend school. Advocacy takes different forms. This is a typology by Keck and Sikkink, who are two excellent scholars from the 90s. They talk about information politics, which is telling people about things, symbolic politics, which is creating images, leverage politics, which is sort of leaning on people, sometimes financially, sometimes morally. And accountability politics is pointing out when people don't do what they say they're going to do. Again, this is a real close summary. And then my favorite, and the focus of most of my academic research, is direct action. When activists actively seek to do what they want to do, to actively bring about the change they want to see in the world. This is different than, say, protesting. Protesting, you're asking someone to do something, an insider approach, or even an outsider approach. But direct action is when you do that thing yourself. You actively bring it about. So that's a very quick survey of years of academic analysis of different campaign strategies. But rather than bore you with that, and if you're interested, do check out Keck and Sicking's book, and there's lots of different resources out there. I want to dive into a couple of examples. And the first one I want to talk about is a conventional insider campaign. So this is a campaign that I helped found with my co-founder, Devin Black, and it's a campaign for free prescription contraception. We launched in British Columbia about 4 years ago, and we started off as a Twitter campaign. We were just a Twitter account. We had a great logo designed by a doctor from Calgary, and we had an idea for a policy. And the first step that we did was we did some research into the issue. And I'm not going to spend as much time as I'd like talking about the issue. If you're interested, you can learn more about the need to remove barriers for people accessing contraception at the AccessBC website, accessbc.org. But generally, we started with a couple of steps. The first step, we had a Twitter account, and it tweeted out regularly. Go back to our Twitter account there. It tweeted out regularly information about contraception and news articles about innovation and barriers to contraception. And just generally speaking, there's a need to do this. I think most people who are here probably already know there's a very strong need for more activism around reproductive health. But the fact is that people face lots of barriers when they're trying to access contraception. And one of those barriers is cost. We always recognize that it's not the only barrier, and there are definitely other barriers out there, and they tend to compound, such that someone perhaps living in a rural community from a marginalized community might face an even greater barrier to accessing contraception than someone living in downtown Vancouver, for example. And this is a problem because if people don't have access to prescription contraception, they can get unplanned pregnancies, and unplanned pregnancies can derail life plans and have impacts on the infant and mother and have a huge cost for society. So there's really good reasons to help people prevent unintended pregnancies. Also, just the general fact of agency and helping people make choices about what happens to their body. I think that's probably the most fundamental point. Contraception is expensive. Right, so an IUD costs about $380, $370. And this was kind of what launched the campaign. So I was doing my grad school in the UK, and in the UK, all prescription contraception is free. It doesn't matter if you have a monthly pill, which might cost in Canada about $20 a month, or if you're using injections, which might be $180 a year, or an IUD. A copper IUD can be $75, and a hormonal IUD can be about $380 Canadian. All of that's free in the UK. My partner and I came back to Canada, and I was quite shocked to find out that that wasn't the case here. And I connected with one of my oldest political friends, Devin, who is right there on the screen there with the blonde hair. And we launched AccessBC. So again, it started off as a bit of research. So our first step was researching the issue, learning more about it, finding out that there was an amazing study in British Columbia that showed that programs that offer prescription contraception, that if we were to create a policy in British Columbia, this policy would save the government $90 million a year in direct and indirect medical costs and social costs. That was really helpful. And we did a bunch of research into the issue to learn more about the policy itself and to learn more, to be able to more effectively do advocacy. So we produced a briefing paper, and we surveyed the ground on the situation in British Columbia, and we realized that British Columbia is quite a progressive place. The NDP had a very good chance of winning government, and and Devin and I had a history of doing NDP politics together. She was my communications director the first time I ran for parliament in Alberta in 2006, when she was in high school. I was barely out of high school. So we've been doing politics together for a while, and we thought, if we can convince the NDP to endorse this policy at their convention, and they form government, they'll just implement the policy. So there's Samantha talking to our motion at convention. It passed at a provincial convention, and we were very excited about this. After the convention, New government was formed about a year later. This was the 2017 convention. 2018, the NDP comes to power with John Horgan. It's a minority government. Things are complicated on the ground. The Green Party holds the balance of power. And we go up to the Ministry of Health and we say, hey, party has implemented this policy at their convention. How can we help you pass this and make sure that the policy is implemented in the province? And they told us, well, this is a really good policy. We've been studying it for a while. We know it exists, but it's one policy among others. And so we really need public pressure to convince us that we should do this policy and not one of the many other policies we're considering. We were a little bit disheartened because we thought it would be a lot easier to get it passed. And so that's when we launched a public-facing campaign. So before all this, we were basically a Twitter account and insiders trying to work through the party structure. Then we launched a public letter writing campaign. So we had not as many tabling opportunities as I would have liked. COVID kind of got in our way, but we had tabling events at colleges and universities. We got thousands of letters pouring in from around the province, and we did 4 or 5 major things. So the first thing was we started building a network. Devin and I both came from Alberta. We didn't have a lot of contacts on the ground in British Columbia, and it was just us and a couple of friends who kind of joined the campaign early on. So we started reaching out to other organizations that were potential allies, unions, students groups, women's groups, doula collectives, all sorts of manner of different organizations. And this is really important because we didn't have that detailed network, nor did we have an extensive list of supporters. But we did have, these groups did. And so we were able to sort of tap into their networks. And that was a really effective tool. And it was very slow at first with some small organizations joining us. And then we started picking up steam. And just, I think last week, the BC Federation of Labor just passed a resolution endorsing our policy at their annual convention. So these things take time. I think that's one of the biggest lessons I have. When we started this campaign, we thought it was going to be over after the first convention. And it's been 4 years. We've spent about $10,000 of donations, but we're getting really close. And I'll get to that in a second. We built a team, so we started recruiting people. We actually recruited people very organically. So when we were running a table at, this is Erica, who we met at the Women's March. The next year, she was tabling for us at UVic. So we met people very organically. One of the weaknesses we had was we mostly met people in our local situation, and that meant like Victoria and Vancouver, and we didn't get to connect with people in more remote communities. And we've been working on building that up over time. But we have a really amazing diverse team. We have over 60 core volunteers right now that do everything from running our social media to writing letters to doing public consultations. We did the letter writing campaign, which we ran for probably longer than we should have. We spent a lot of money advertising that once we tapped out our own local networks. But the letter writing campaign basically created a steady flow of letters going into the Ministry of Health and people's local MLAs, and turned out to be very effective over time. One of the things that we worked really hard to do was to ensure that the letter writing campaign was organic, so that when politicians were getting letters, they weren't just boring form letters, but the letters seemed tailored to each individual, which helps make them, elevate them in the eyes of the people reading them. And finally, we started doing budget consultations. So we met with politicians, by the way. This is us meeting with Rob Fleming, who was just appointed Minister of Transportation a couple of days ago. He's my MLA. And we sat down and met with basically any politician that would meet with us from all across the aisle and had some very interesting conversations. And we participated, we did lots of media and outreach. So it's really hard for a small group to get media. We were quite adept at using hooks. So events like the Women's March, International Day of Contraception. Anytime there was an international day of something, we had a press release and we were ready to go. And we started getting a little bit of press, and it picked up as we started, we changed our tactics up a little bit. And we started participating in budget consultation. So the provincial government has a budget consultation process where you can actually, as an organization, submit your ideas for the budget. And we've done that for 2 years, in 2018, 2019. Or 2019, 2020, and both of those years, the committee supported our policy. So going through the formal chain of government consultation took time. It meant sitting through meetings. This is a presentation to the city of Victoria that took a long time to set up, or Vancouver, sorry. And so we took our time working our policy through the official channels. Again, an insider approach. We were friendly with politicians. We explained to them why this would help them. When we did the budget consultation in 2019, the committee endorsed the policy. but it didn't make it into the budget. We were really disappointed in 2020 when we didn't see that policy in the budget. And so we launched another range of letters, and we changed our strategy, our tactics up a little bit. One of the challenges that we'd had was we didn't have as broad-based support as we'd like. And upon a random recommendation from a friend, we launched the campaign to get municipal endorsements. So we reached out to municipalities across the province and had them pass motions at their council chambers endorsing our policy. It ended up being a really good tactic because municipalities, there's no expenditure for them. There's no cost to doing this. They get to pass a resolution that says, we support free contraception. It takes them about 10 minutes of their time. We write the resolution for them. We speak to it, and they get to look good. They're supporting something that supports gender equity, that supports people's health. It's great. And so we started picking up steam with this one. City of Victoria endorsed it, and then Burnaby, and then 11 municipalities in total. And a couple of interesting things along the way. We convinced a couple of the municipalities to present resolutions to the provincial meeting of all municipalities, the Union of British Columbia Municipalities. And they passed 2 resolutions supporting our policy. So now we had basically the voice of all municipal governments behind us, which is a really important step. And another fun thing happened was one of the municipalities added to its resolution that they would ask all other municipalities to do the same thing. And so we started having completely random places that we'd never reached out to supporting our policy out of the blue, just because they got an email from New Westminster. So that turned out to be very successful. And then right as we were, I'll get back in a second, right as we were sort of gearing up for this municipal strategy, there was a snap election here in British Columbia. And this is sort of one of the other lessons for campaigning is you have to be quick on your feet and you have to adjust to changing circumstances. So we were sort of all hunkered down for this municipal strategy, and then boom, there's an election. Well, we ended up getting quite lucky insofar as all of the major political parties, because of all the work we'd done over the previous years, all 3 major political parties endorsed our policy. Some of them in a more roundabout way than others. The NDP included in their platform because we'd gone through the formal process of presenting the resolution at convention and lobbying the internal structure of the NDP, as well as their elected officials. The Green Party included it in their platform as well. We had a couple of our members who were members of the Green Party as well, and they sort of convinced them to include some of the policy in their platform. And then one of the politicians we met with early on in the campaign, we chatted with him. He mentioned he started comparing contraception to eugenics, and we told him that was a bad idea. This was a couple of years ago. Well, he decided to repeat those lines at an all candidates debate during the election. This is Laurie Thrones up from Chilliwack, Kent, an MLA, a candidate for the then Liberal Party at the time. And this, of course, was a ridiculous and inappropriate statement. So much so that his own party asked him to resign, or he was voluntold to resign, and then endorsed our policy. So we were quite pleased that Andrew Wilkinson, the leader of the Liberal Party then, fully endorsed our policy in a tweet. Again, it's not their platform, but yeah, we'll take it. We'll take what we can get with that. So where we're currently at, the campaign's not over yet. Just last night, I uploaded our next stage of the letter writing campaign. So we're currently pushing the government to include the policy in the 2021 budget. 2021 budget. We're very optimistic because the most recent mandate letter to the Minister of Health included a bullet point on implementing free contraception. So we're quite optimistic, but we're not taking anything for granted. So we're continuing our letter writing campaign. We'll continue lobbying. And that's kind of where we're at in British Columbia. A couple other great things that have happened is we have sister campaigns now. So anyone who's out there that isn't already following AccessBC, you don't need to follow us. Please follow Contraception. This is the Cover Contraception campaign for Ontario. They've got a fantastic grassroots campaign that adjusts some of the strategy that we were doing with AccessBC in British Columbia and adapts it for Ontario. And it's a great campaign. Please give them a follow. We're working on helping friends set up campaigns in Manitoba and Alberta in the north. And if anyone has any friends anywhere in Canada that are interested in running a similar campaign, please have them get in touch. The other thing we're considering doing is pivoting. So, once a campaign is successful, the next question, of course, remains, what do you do next? And so we're considering our options. And as a team, we're going to meet and try to see if we want to explore other barriers to contraception, because there are many, or whether we want to focus on other reproductive health issues or what have you. That's an important process. It's one of the biggest lessons I've learned is changing up our leadership structure to accommodate a more diverse group of members. The campaign has been very much stripped for speed. We've had a small core organizing team with a broader universe of volunteers that will occasionally work on projects, and we're moving towards adopting a different structure to fit the future of the campaign. But yeah, that's a classic insider campaign, right? That's when you have a receptive government that's not oppressive, and you know how to work your way through the system, and the system is accommodating to your recommendations. But unfortunately, that is not always the case. So the next example I want to cover with you is an outsider approach. And this is a group that I've been studying for a while. My academic work, as you mentioned at the top of the show, it looks at the strategic use of international law by non-state actors. Now, my PhD work looked at Sea Shepherd, which is a marine conservation organization that uses confrontational strategies at sea to do marine conservation work. I did my PhD. I got to go down to my field work for my PhD, rather. I got to go down to Antarctica on one of their ships that was stopping Japanese whaling. And by stopping Japanese whaling, I mean physically preventing whales from being loaded onto vessels, throwing butyric acid at vessels, using prop fowlers and things like that. So very confrontational tactics, classic direct action. And one of the things that I was interested in was what other organizations are doing interesting things in the high seas. The answer is not very many. The high seas are a very difficult place to operate. When we talk about barriers to activism, it's not hard to set up a Twitter account or to get a couple of friends together to write, terse letters to your elected officials. But if you want to have a boat at sea, it does tend to cost a bit of money and time, and you need to have expertise. I'm a prairie boy from Alberta. I had to learn how to sail over the course of my studies. So there are different barriers. If you want to operate on the high seas, there's definitely lots of barriers, but it has some great benefits as well. Organizations that are doing things in the high seas, there's a small fringe range of libertarian anarchist folks who are trying to set up their own countries. I do a talk about that. It's a chat for another day. Palestinian blockade runners, and then Women on Waves is the most prominent example. So briefly, I could talk about them probably all day, and I wish I could, but Women on Waves is an organization that they have a really collaborative approach. So they're an international organization that's based out of the Netherlands, but they work with local activists to draw attention to the consequences of unwanted pregnancy and illegal abortion, or to draw attention to the harms of when abortion is made illegal. And they work to try to convince countries to change their laws to increase access to abortion. And they have a wide range of strategies and tactics that they pursue. And so I'm going to focus, I'll do a brief survey of some of them because I want to give people ideas of sort of the range of outsider approaches you can take, and also because they're incredibly cool. If you're interested in a deeper dive into Women on Waves, do check out the documentary Vessel, which is sort of a deeper dive into some of their earlier campaigns and is, in my mind, absolutely brilliant and very eye-opening as far as what some people are up to. So what Women on Waves became famous for was providing safe medical abortions and safe abortions on vessels in international waters. And this is Dr. Gompertz. She founded the organization in 1999. She's a Dutch physician, artist, and she was previously the ship's physician on the Rainbow Warrior 3, which is a Greenpeace vessel. And her backstory is basically when she was traveling around with Greenpeace, she started encountering women who were encountering unwanted pregnancies in countries that had incredibly restrictive access to them. We're very lucky in Canada to have, we do face problems here in Canada, don't get me wrong. We have, some provinces that are closing down their only clinics. We have, limited access to different clinics. Remote people in remote communities and rural communities face huge barriers of transportation costs. There's stigma as well, all these different factors. But in some countries, you can go to jail for having a miscarriage or for seeking an abortion. And you can go to jail for a very long time. And in countries like Poland, we see, otherwise semi-progressive, do a bit of an eye roll there, but we see, countries moving back and rolling back on people's right to say what happens to their body. The United States is another example. Despite the change in government, hopefully, we still see a Supreme Court that's packed with people who support forced birth, right? And don't think people have a right to choose what happens to their body. So there's lots of need for this. And basically the Women on Waves formed in this kind of situation 20 years ago now. And their motivation is to prevent unsafe abortions and to empower women to exercise their human rights to physical and mental. Well, let me try that again. Sorry. Their motivation is to prevent unsafe abortion and to empower women to exercise their human rights to physical and mental autonomy. And basically, I won't go into all the background around the statistics around access to abortion around the world, but there are still lots of barriers to people accessing safe medical abortions. There are far too many countries that have bans or partial bans or ridiculous regulations. And then there's lots of efforts these days by pro-forced birth activists who are basically trying to, say, oh, well, yeah, abortion's legal, but we're gonna bury clinics in so many regulations that they have to close. For example, what's going on in Texas. You'll see legislators trying to pass laws around, emitting privileges, or hallways have to be a certain width, trying to force clinics to shut down. And this is a serious problem, right? Globally, 25% of pregnancies are ended in an induced abortion statistically, and 4.7 to 13.2% of maternal deaths are attributed to unsafe abortions. So this is a problem that's killing people around the world. And I mean, some of the stats are quite disheartening. But one thing that's interesting is that countries with restrictions on abortion and countries with permissive regulations around abortion, there doesn't seem to be that much of a difference in the rate of abortion. People who want abortions will find them. If they can't find them legally and safely, they will pursue them in an unsafe way. So fighting for safe abortion is incredibly important because people just need them. The statistics, for example, are again, they're very similar. And there's been some progress, though. Between 2000 and 2017, 33 countries expanded the circumstances under which people can seek abortion. But again, as I said, there's been some rolling back with the United States and Poland. For example, in Ecuador, you could face up to 30 years in jail for seeking out an abortion. So that's chilling. So what has Women in Waves done? They've done a wide range of what are, in my opinion, incredibly innovative direct action tactics. And we'll explore how these work theoretically towards the end here. But here's some examples. So these are, they're image events, by the way. We have abortion robots. So in May 2018 in Belfast in Northern Ireland, this robot was used to deliver abortion pills to a woman seeking an abortion. The abortion pill, by the way, is mifepristone, mifgamizo. These are ulcer medications that many years ago women discovered can cause a miscarriage if used in a certain dose. They read the label of the package. It said may cause a miscarriage, and then they experimented to figure out how many pills it would take to do that. It's a fantastic innovation, but it's a fantastic medication because it can demedicalize the abortion process. So people can go to a pharmacy and get a pill for an ulcer and then go have an abortion, a safe abortion at home up to a certain point. Which kind of demedicalizes the process. And I can go on a bit of a longer talk about that if people would like to ask questions about that afterwards. But generally speaking, Ireland had very restrictive access to abortion laws. And this robot was used to deliver medication to 3 women at a rally who then consumed the pills on camera. So in a sense, triggering a miscarriage on camera. Of course, it takes much longer than that. But this is a very dramatic image event. The robot's very innovative. And particularly because this robot was operated remotely from the Netherlands, where abortion is legal. And so the police couldn't really do anything. And my favorite line is the robot filmed its own arrest. Another example was in Ireland, where we have, again, people who are taking abortion medication at events. Again, it was criminalized back then. And here's an individual quite literally consuming mifepristone and at an event surrounded by media. And then again, we have examples in Korea. So in August 2018, 125 individuals swallowed abortion pills in defiance of South Korea's very restrictive laws on abortion. So again, we have an element of performance. It's public, it's overt, but we also have innovative techniques like drones and robots being used. And very recently in Poland, in December 2018, there was, in order to get around regulations, they set a play. So actors would deliver scripts around how to give yourself a safe abortion at home as part of theater. And one thing that Women on Waves does a great job of doing, or innovative way of doing, is combining art with activism and medicine. So there's sort of this pyramid of things, which often makes it more difficult for the authorities to go after. You might not be able to do a protest, but theater is theater, and the high seas are the high seas. So the campaigns that most captivated me were the Women on Waves marine-based campaigns. because the high seas is a different place. The laws of the high seas are different. You tend to fall under the jurisdiction of your flag state. Governments have the lower ability to interdict your vessel, to arrest you. So if you do a protest and you drop off an abortion pill by robot and at a protest, they can arrest your robot. But if you do an abortion on a vessel at sea, it's much harder for a government to interdict your vessel because of international law. So you can basically cover yourself in a warm weighted blanket of international law and operate in this sort of fuzzy gray area of legality that allows you to do great activism and to help people out. So what Women on Waves did was they created an abortion clinic in a portable and put it on the back of a boat. Now they ran into some problems. They were going to give like full medical abortions and like aspiration, and but unfortunately they couldn't get licensing in the Netherlands. So they ended up just focusing on creating a safe space for people to consume pills that would abortion pills rather than doing different kinds of abortion. And they launched a wide range of campaigns. You'll notice they're quite spread out because these are intensive campaigns. There's lots of fallout. They take time to set up. And as I mentioned at the top of talking about Women on Waves, they're very good at working with locals. So they don't come in as sort of a savior, but they work with local groups to empower them, which I think is really important as far as elevating other groups, but also connecting with locals. In 2001, they did their first test case in Ireland. They had some licensing issues. This didn't really work out that well. The Dutch government is very defensive, defends navigation of the high seas quite aggressively. Hugo Grotius, the person who wrote them, is Dutch, and the Dutch have always been very strong supporters of freedom of navigation. So if any of you ever want to do something at sea that might be a bit controversial, get yourself a Dutch flag. Greenpeace, Sea Shepherd, all these organizations use Dutch flags. Now, they went in 2003, went to Poland, where they demonstrated that the model works. You have a vessel, they help people get abortions, they will ferry them from the vessel out to sea, out to the 12-mile limit. In other situations, they'll use smaller boats. There was lots of counter protests. And as you can see, there's still issues in Poland today, and it's getting quite bad in Poland. 2004, the Portuguese Navy sent a warship to interdict Women on Waves vessel, citing a national security threat. This case actually made its way to the human rights case, the European Union, and Women on Waves won a whole euro in damages. But this just goes to show the kind of dramatic images you can create. This is a boat with a bunch of women who are just trying to give people an abortion, a safe abortion, and those are military vessels interdicting them. You have this great, powerful image event that just shows the power of the state trying to basically, it's sense the patriarchy crushing a boat of feminists. Spain, again, this is 2008. Activists counter-protesters tried to physically tow the Women on Waves vessel out of port, but they successfully delivered abortions. And by the way, it was legalized in 2010 in Spain. And a lot of times these actions of Women on Waves serve to catalyze further action to give additional attention to local activists who might be struggling for attention and press. Morocco, this is the one I have probably the most respect for Dr. Gompertz with. She jumped out and was leafleting this crowd of very angry people. They closed the harbor down. There was a bunch of really interesting tactical exchanges. But again, raising awareness for an important issue. And you notice on the image of the vessels, they always have a phone number. And this is in Guatemala in 2017. Actually, a friend of mine who was the chef on the boat was arrested in this case. And the phone number is important because it's image politics. There's a website, there's a phone number, and the phone number goes to a local line that you can call to get instructions on how to have a safe abortion at home. And so Women on Waves isn't just going to provide 1 or 2 abortions to people on the vessel, but their goal is to educate people all around the country. This vessel was blocked by the Navy, by the Army. In 2007 in Mexico, they successfully delivered a number of abortions. So as I said, Women on Waves also formed Women on Web, which is a website that's been banned in many websites, many countries rather, but they provide information on how you can have a safe medical abortion at home with pills. And again, this is part of the outreach and education element of the campaign. And I could go, I'm going to start wrapping up here, but I could go into more depth. And if people are interested, please do ask questions. But basically what you have is Women on Waves is using iconic images, powerful images, and media events drawing attention to themselves by using a clever use of international law. But they're also backing it up with education and outreach. There's some really interesting aspects about making something that's very private, an abortion, very public. So people are physically having abortions in public. And there's some really strong ways that they're using that imagery to combat traditional taboos and stigma around abortion. And one of the things that I've been trying to decide as a scholar on this subject is to what extent are these image events where the purpose is to create an image and captivate media attention, or direct action where they're physically trying to provide abortions. In the case of Women on Waves, I see it as being much more oriented around image events. The service provision is important, obviously. People are getting access to abortion, but the number of people who get access to abortion through their actions is smaller on the vessel compared to the overall change they've had in countries. But that change has been huge. And why ships are so important as image events is ships are seen as a symbol of freedom, the freedom of the seas. And there's something very empowering about operating your own vessel and going where you want and standing up to the Portuguese Navy. So I can go into a bit more depth on that, but I think I'm going to wrap up towards the, oh, here we go. Sorry. Yeah. So I see that, Women on Waves is a bit more towards the symbolic side of things, but it's very powerful symbols nonetheless. And one of the things that makes them powerful is the combination of direct action and service provision to create what Rex Weiler, one of the original founders of, Robert Hunter, rather, one of the original founders of Greenpeace, called a mind bomb. These are kind of very poignant images. When I say Greenpeace, you probably have an image of someone hanging on a smokestack or a small boat in front of a large whaling vessel. These images cut through the day-to-day humdrum of normal media, captivate people's attention. There is a boat with abortion pirates on it is much more interesting than the statistics that we can talk about relating to people's maternal health and access to safe abortions. So you create a hook for people to sink their teeth into to learn about an issue by creating an image event. So that is, I'm gonna leave it at that for those two organizations. And I wanted to very briefly cover some other groups. I feel like we're gonna run into time things and I want to get some questions. So I will just flag some of the other issues that I'm looking at working on with respect to, let me stop sharing my screen here. There we go. With respect to other issues. So we've talked a bit about access to contraception, access to abortion. There's a couple of other ones that are kind of on my radar for looking at and issues that may have a challenge when it comes to doing activism. When it comes to doing reproductive health activism, the roots of the patriarchy run deep, right? We've got countries rolling back years of progress, and we've got stigma and taboo about talking around about sex and talking about contraception. And so one of the things that, we have two general areas, right? We've got defending what we have, and we have pushing for more. So when it comes to defending what we have, there's things like education and outreach. I've got friends who do lots of education around this. One of the members of the AccessBC team is an abortion doula, and they go around teaching people how to have safe abortions at home and working with them through the process. Education is critical. I taught sex ed for a couple of years when I was a teacher here in Victoria, and it's important that kids get access to accurate, up-to-date, judgment-free information about sexual and reproductive health. And clinic escorts. I don't know about you folks, but I've spent probably too long on TikTok, and there's some amazing women out there who are doing clinic escort work. A lot of it's in the States where you have angry mobs of people harassing women who are women and people who are with uteruses who are trying to get access to medical care, and escorts are incredibly important in that situation. Those are holding patterns, though. We're defending what we have, and that's critical. But we also have to keep pushing for other change. So in addition to access to contraception and access to abortion services, there's two other areas that I'm currently, that are on the radar at the moment. The first are crisis pregnancy centers. So these are crisis pregnancy centers are anti-choice agencies that present themselves as an unbiased medical counseling service, but prey on people in vulnerable situations and provide them with biased counseling. And the goal of these organizations typically is to move people away from abortion by maybe not giving them all the accurate information or maybe lying to them. In the United States, there are some examples of crisis pregnancy centers being set up with very similar logos to local women's clinics with people dressed as doctors. So they use a lot of manipulative tactics to try and convince people not to have abortions, and they're all across Canada. The ones in Canada don't tend to use as overt ones as in the States. They tend to be quite good at staying within the law, but it's very worrisome that they're preying on people in vulnerable situations. And the other one that I've very recently just touched looking at are maternity homes. There's a couple examples across Canada, but these are places where typically they're all run by religious institutions, and that people will send their unwed mothers, in air quotes, to these places to give birth. And there's often cases of coercion so that the person gives up the child for adoption. And they're very much preying on people in vulnerable situations. It's a subject I'm just learning about now, but I wanted to put that on people's radar as an issue to explore, because the strategies for addressing these are different. with the crisis pregnancy centers, they're all very good at staying within the law in Canada. And so, you can't really go at them from a legal perspective, but maybe education and outreach is the case. And similarly with the maternity homes, in this case, information politics might be necessary. But there are some challenges to addressing these because they're hidden, they're quiet, and the political opportunity structure is different. So with that, I want to encourage everyone who's out there to use good strategy to fight for reproductive access to reproductive health, and to help smash the patriarchy. And with that, I will go to questions, and thank you all very much for listening.
Thanks so much, Teale, for this amazing presentation. Very comprehensive. So we have a question here. One of the photos shows women wearing Handmaid's Tale clothing. That TV series is brilliant, don't you think? We see the USA as a modern country, or we did, but freedoms are being more and more limited for women, USA and elsewhere.
The handmaid is a very poignant image, but it also shows that activists are tapping into the local culture, the culture of the time, right? People understand what handmaids are. Now, I imagine, that Handmaid's Tale is actually a very excellent piece of literature, so it'll sort of transcend into the future. But 5 years ago, this would make no sense, right? And so these activists are using the imagery and tapping into sort of this visceral reaction that I know I certainly got when I was watching Handmaid's Tale and reading the book, and tapping into sort of the cultural images. These are powerful images. Like, this may just seem like a bunch of people in cosplay, but what it is this is a person actually having an abortion. So this woman is physically starting the process of having an abortion in public. And one of the things that I think this is captivating in the literature around mifepristone, mifepristone, and abortion pills in general, there's some fascinating social science literature on the idea of demedicalizing abortion. So we consider abortion often as a medical procedure that you have to go to a clinic to. And in the States and in some places in Canada, that might mean going through a mob of angry protesters yelling at you and telling you that you're going to burn in hell, just because you want to get a medical appointment. But abortion doesn't have to be that way, right? You can take mifepristone and mifepristone at home and have an abortion safely in the comfort of your living room. And I've read some really interesting articles. There was one about Latinx women in California who, the title was called Bleeding Alone. It was really horrible. Like, it was a pretty heavy piece of writing, but it was qualitative interviews of people who had given themselves abortions in their living rooms and their experiences. And the biggest issue for them was fear, and not knowing how the process worked. And this is why people like abortion doulas are so important, right? It's someone to walk you through the process. But the idea of demedicalizing abortion, I think, is fascinating because it takes control from someone's body. You don't have to have a doctor or a clinic as an intermediary. You have full control over what happens to your body. And I think that's quite fascinating. I think that's the kind of contrast you're getting in images with some of the image politics of women on waves. But yeah, these images just seem like someone's taking a breath mint. That's an abortion pill. That's incredibly powerful to see as an image. And the vessel as well. I don't know, just as a brief interjection on vessels, but those powerful shots of Greenpeace, of someone holding up the little sign that says "Niet" in front of a whaling vessel it sticks with us culturally.
Okay, comment on a question from Aaron. There's a good study on the scary history of maternity homes, which is Bon Secours Mother and Baby Home in Tuam, Ireland. It's thankfully closed at this point, but what a terrible legacy. And the follow-up question, is there any movements or organizations similar to AccessBC that you know of in Saskatchewan?
Aaron, great question. Yeah, and I think there's a documentary or a live action video film about some of the maternity homes in Ireland, and that was quite eye-opening to see. The shocking thing is that I learned recently, talking to our friends at the ARCC, the Abortion Rights of Canada Coalition, is that these groups still exist. They've kind of not gone underground, but they've altered their modus operandi a little bit, but they still exist and they're still funded by far-right religious organizations. And if you're interested in learning more about these, there's some excellent articles that sort of summarize them. I've got one open on my desktop here. I was checking it out. It's from the Origins Canada that looks around accessing people, finding their birth parents, and they go into a bit of depth about some of the situations that arise, and they're not pleasant with what's happened historically. The current ones, of course, are a lot better, but there is, of course, the concern that there's harms being done. And so one of the things that I would want to focus on with research around that is identifying those kinds of harms and then tackling them. It might mean going after tax exempt status. Some groups might be using deceptive techniques. They might be lying about medical qualifications. There's that approach. But yeah, it's one of the ones that I'm still trying to wrap my head around as far as how we can address it as an organization and do activism around that. And the question was, are there groups in Saskatchewan? We have talked to a couple of people in Saskatchewan, but nothing has been set up. If you were interested, please get in touch. One of the ideas behind AccessBC is, and this actually speaks just generally to the broader point of my talk, which is insider versus outsider. There shouldn't be barriers to activism. Now, sometimes there are because we don't know how the system works, or we don't have a boat or a drone to drop off abortion pills. But generally speaking, anyone can become an activist, and it's just a matter of selecting a strategy that works. And so one of the goals that we have at AccessBC is helping people surmount some of the sort of the early barriers, which are things like just not knowing where to get started, or how to maneuver your policy through government. So Saskatchewan would be a ripe location for a campaign. I know that current provincial government may not be as receptive to such a policy as British Columbia. But here's a really interesting thing about the rhetoric around and the argumentation that we used around access to contraception. In my opinion, it is a winning argument, and you can convince anyone except for a misogynist to support the policy. Because even the most fiscal conservative person, there's a fantastic case for access to contraception. The study that we found here in British Columbia from Options for Sexual Health from 10 years ago, you can find it on our website, shows that for every dollar that's spent on providing access to contraception, the government saves $90 in savings in both direct medical costs and social costs. And so those kinds of savings are enormous, right? It would save in 2010, it was estimated that this policy would save the provincial government $95 million. Now, there's an outlaying cost. It's going to cost about $60 million to implement, but it's going to start paying for itself within a year. So when we sat down and lobbied conservative politicians, we would maybe take the approach of like, look, you like saving money, you're fiscally responsible, not that people on the left aren't, but you're concerned with saving government money, and there's a lot of red tape. There's all these programs that currently exist. There's a hodgepodge of programs for people trying to access free contraception. For example, in British Columbia, if you make below a certain amount of money, you qualify. Great. It's $13,000. If you're living in Vancouver on $13,000 a year, I please let me know how you're doing it, because it's not possible. It's an incredibly expensive city to live in. So when it comes to cost, we were able to talk to conservative politicians about that. The story of Laurie Thronez, the politician who kind of was responsible for getting his party to endorse our policy, but who hated the policy. We had a very strange lobbying experience with him where, we knew he was vehemently anti-abortion. And one of the great ways of reducing abortions is to provide free contraception to people, because when you do this, people have fewer unplanned pregnancies, and all the evidence demonstrates this. So the conversation we had with him, apart from the aside on eugenics, which that lesson didn't stick, but the conversation we had with him was around how this will reduce abortions. So when it comes to access to contraception, I think every provincial government in Canada should be receptive to this, because it increases maternal and infant health, it saves them money, it increases equality and equity, and it saves people money. And saves the government money. So there is really no good reason to oppose it. One of our team members is doing a research project for her master's on the campaign and policies around it, and messaged me the other day and was like, are there any good arguments against this policy? And the only one I could think of was no. They're all misogynistic. There aren't any. It's an excellent policy. So in Saskatchewan, get in touch. We'd be happy to help you set one up. And it's not that hard. It takes some time and a bit of effort, but it's very accessible. Sorry, that was a bit of a longer answer, but I'm really excited about setting up sister campaigns across the province, because the model that we've developed, it's a classic insider model, and it seems to work as long as you stick with it. And there's some other questions here, I guess.
Yeah. So do you anticipate relating these matters of personal agency to the need to reduce world population to combat the destruction of our planet through ecosystem collapse and climate change? And if so, how?
I mean, one of the challenges you get, like I do a lot of environmental activism, I work in marine conservation, and one of the challenges you get, of course, is that we have a massive burden we put on the planet, and as the population goes up, that definitely has an impact. The solution, of course, one of the challenges as well with tackling things like climate change is you have some countries that are trying to catch up, they're in French, en voie de développement, they're currently developing, and the climate was in Copenhagen in 2016, 2015, well, it was a while now, 2009, whenever Copenhagen took place, the COP15 there, we got tear gassed and people were screaming at the convention looking for real change. And the issue that comes up with climate change is developing countries want the ability to develop. But one of the most effective tools of development is empowering women. And so not only does this policy, help individuals, but it also helps countries develop, because you're tapping into a workforce, you're allowing people to flourish, to meet their full potential. And that also has environmental implications. Countries that are impoverished or that are struggling to develop have a huge environmental footprint. I have a report coming up, this is very tangential, but I have a report coming out on marine plastic pollution next week. And one of the challenges you find is, transitioning to sustainable, there are sustainable products for almost every single thing you use that's a single-use plastic item, but some of them are expensive. And one of the classic examples is shampoo. So, I can afford to buy a $12 jug of shampoo, or we buy it for Lush, so we buy a shampoo bar. That's a lot of money. People in developing countries who are not doing very well may only buy single-use shampoo, the little plastic packets. What happens to that plastic packet? It goes into the environment. And those build up over time. Poorer countries can't afford good waste management systems. So yes, I think these things are all interrelated. But I think the critical thing is giving people agency and allowing them to make choices about what happens to their bodies. Yeah, that was a longer answer, but see Ocean's Age's work on marine plastic pollution.
A question about crisis pregnancy centers. Can you give an example of a strategy or tactic you might use to combat them? And secondly, do you think it's better to oppose CPCs, or is there a possibility to educate some of them to move away from being anti-choice?
Those are really good questions, and I think choice, we'll have to have a longer conversation about that, you and I. I'm still mulling over options for crisis pregnancy centers. There's a couple of approaches, I think, at this point. Early on in our campaign, we had a tweet where we complained about a bus ad, and going after advertising isn't going to work because they're very clever. They don't violate advertising standards. They're not technically lying on their advertisements. So apparently you're allowed, as long as you follow advertising standards, you can advertise for a product that might take advantage of people in vulnerable situations. I don't have a good strategy at this point. Some of the strategies that I'm contemplating and the BCHA is looking into are looking at tax exempt status, because a lot of these organizations are funded by churches who are funneling money from their coffers. And a lot of those churches are tax exempt. They're getting tax exemptions for their land, free tax donations. And so there's potential there. I think that's something that's worth exploring. And then local zoning regulations can be explored too, right? Municipalities shouldn't give zoning to a clinic. If it's operating as a clinic, they should have licensing as a clinic. And if they don't have licensing as a clinic, they shouldn't be operating as a clinic. So I think you can tie things up in red tape from there. But it's a big challenge. And I'm still trying to wrap my head around how we can go about doing that. The first thing we should do is more research. The informal motto of my research consultancy is there's no problem we can't research our way out of. More knowledge is always better to better understand a problem. And the second part of the question, it just got removed, but I think it was on trying to educate crisis pregnancy centers versus shutting them down. I mean, I would say on a case-by-case basis. Ideally, if people are getting medical advice, they're getting comprehensive medical advice that's unbiased. The kind of unbiased counseling, the kind of biased counseling you get at crisis pregnancy centers is at least a violation of the person's right to access to accurate information that's up to date. And it could be I think it's a lot worse than that. I think that if you're going to have a clinic, it has to be run based on standards that apply to everybody, and having special clinics that are run by religious organizations that have a motivation is probably not ideal. But that being said, it's very hard to shut them down. So the optimal approach would probably be dealing with them on a case-by-case basis and going after the more egregious violators that use the more coercive techniques or the more disreputable techniques, just because, in an ideal world, these wouldn't exist. But because they do, we probably have to tackle the most egregious offenders.
Okay, we have.
If anyone has any ideas, please send them along, because it's developing new strategies is always a challenge.
Okay, time check is 4 o'clock. There are 3 great questions. I'm not sure if we want to wrap up at this point or take those questions. What do you think, Teale?
Yeah, I'm happy to take more questions too. And if, by the way, if folks want to get in touch, go to the AccessBC website. We do have a form you can fill out, and I'm very easy to find. I can put my email in the chat after as well. So the first question is, can you explain how safe this home abortion can be? I was going to I don't have the numbers in front of me on this one, but I would probably direct people to Women on Web's website where they explore the different risks. Obviously, there's different risks for how far along you are in your pregnancy. But if you're taking mifepristone, mifepristone up to 9 weeks, it's basically like a very heavy period. Very heavy being, depending on how far along you are, it can be quite heavy. So that's a lot of the literature that I've been reading about talks about people being alarmed at perhaps the quantity of blood. But my understanding is it's quite safe depending on the different situations. And it's probably almost certainly safer than going through with a pregnancy, which is much more dangerous than getting an abortion. And that's often something that's overlooked in a lot of the heated debate around abortion. And there's a second part of the question.
Is there a possibility that girls will not have
does it
babies, will
impact
not be able
like
to have
long-term
babies in the
fertility?
future? Yeah.
I
And
don't
by the way, Laureen just posted a link in response to the previous question. So thanks for that.
Perfect.
And so your question was a no.
Yeah, I don't believe
Sorry,
that.
Your response was a no. Yep.
Yeah, I don't believe it does. I mean, again, this is medicine, so people have different reactions. But in most of the contraceptives these days are fully reversible. They're called, LARCs, long-acting reversible contraceptives. And so, obviously there's rare occasions where things go wrong, very rare. But no. My understanding is it just causes a miscarriage, like a heavy period, and so yeah, it wouldn't have impact long-term fertility. I'm not a medical doctor though, so please consult if you have questions about that. Do consult with someone who is definitely more knowledgeable about that subject. I'm an international relations scholar. The only thing I'm allowed to prescribe is whiskey.
Okay, thanks. So well, the next one is pretty cool. What is the sign that the woman with the pill in her mouth is holding?
Oh, I don't know. It's probably get your law off my ovaries or something similar. Yeah.
Get your rosaries off my ovary. Is that something like that?
One of the things I love about Women on Waves is they have this combination of art and activism, and you do get some great images, but also very clever protest signs. I don't know about you folks, but I've been seeing some of the less than clever protest signs coming out of some of the anti-mask and Trump folks from the States. And it's nice to see people spending time to, do a nice sign that has a message that's clever and impactful. It sounds a bit, the sign I usually hold up at a protest is social sciences against bad research methodology, which is arguably a little bit dry, in an ironic kind of way.
I like that as a nerd myself. Okay, so on the last one, maybe, is there a focus on male contraception, which is a great question.
Yes. Oh, yeah.
Because I just this morning I read somewhere that over 50% of men feel responsible for, what happens to the woman they might impregnate. So, they feel like the burden is on them.
I've got some interesting things on this. So yeah, so the AccessBC campaign, we've come up with a messaging guide, and we try to carefully select our language as best as possible. So for example, we'll try to avoid saying women, because not all people who can get pregnant identify as women. But also on top of all that, we believe that all prescription contraception should be free. And that includes prescription contraception that is targeted towards people with penises. And there are 3 different streams currently being developed right now. I actually had dinner with one of the gentlemen who's on one of the research teams for one of them. The 3 general forms of male prescription prescription, not necessarily prescription, but contraception that aren't condoms. There's one that is an injection that impacts the motility of the sperm, so that it basically doesn't swim around and is not very effective. There's a second research team working on one that's basically a reversible vasectomy. So it's sort of a plastic that goes in the vas deferens that prevents sperm from entering the ejaculation. And then the third one is one that produces a retrograde orgasm. This is the dinner we had in England with the director. And basically there was a test being done for a prostate medication, which in Canada is called Rapaflow. And the people who were taking it were reporting back in the drug trials that in addition to it having an impact on their prostate issues, they were getting retrograde orgasms, which is a dry orgasm. So an orgasm where no ejaculation occurs. And so that pill exists, and it's being tested in some countries. There's a couple of extenuating factors. One is apparently, this is sad, but men were complaining. One of these trials I was reading about, men were complaining about the side effects. And the side effects were like minimal side effects compared to what people might experience with some forms of contraception, people with uteruses might experience with some forms of contraception. And they ended up canceling one of the trials because of the side effects. But we're talking about like headaches and mild mood swings and things that people with uteruses who have used hormonal contraception would be totally familiar with and are like milk toast. So that was kind of interesting and kind of sad. And talking to people who are working on developing these male pills and male options, while a lot of men may feel responsible, not as many of them, unfortunately, are willing to take responsibility. There's still this kind of weird culture of potency and hypermasculinity tied up with people's penises and their ability to ejaculate and impregnate people. And that tends to influence our society such that there's a lot more research being done and development into contraception for people with uteruses rather than those with penises. And that's the problem with our society. So yeah, we absolutely need to have free condoms. Vasectomies are already free in Canada, which is great. And we've used that argument to help with our rhetoric and our campaign as well. And education and removing taboos are super important. One of the things that we've done with our campaign, I know this is a longer answer, but when we reached out to municipalities, we, as part of our outreach campaign, we encouraged them to vote for our motions at the UBCM. And we just yesterday sent out a thank you letter to those. Thank you letters are important. Politicians don't often get letters thanking them for good things. And so they tend to be opened. And so we knew this and we thought to ourselves, rather than missing the opportunity to send a letter, because it takes time and effort to write the letter, we're going to lobby municipalities to do change. And this is something that people who are listening might want to do, right? We don't have to have a province-wide campaign. You can convince your municipality to make a very small change. That change might be having condoms in a dish at City Hall or at government facilities. I got my start doing all this at doing student politics at the University of Calgary. And the University of Calgary would buy a 20-kilogram bag of condoms to have in our little dish at our office. And we'd go through that a couple times a year. And the cost of a giant sack of condoms pales in comparison to the cost of an abortion or an unplanned pregnancy. And so it just makes sense. If you were doing a campaign like that, write to your city council, ask them if they can have condoms at their facilities. Do please make sure that they're not just external condoms. Please make sure there's internal condoms and lube, and that they're made that they're accessible and they're not overly gendered, and we're bringing in people from different diverse backgrounds. That's really important. So that's one thing we did in our letter to municipalities. We said, hey guys, thanks for supporting our policy. If you want to step up and maybe spend a little bit of money to help equality and sexual health and reproductive health in your municipality, maybe consider having free condoms in your facilities. And then the other one, and this kind of steps into sort of contraception adjacent, but free menstrual products. When we presented our motion at the BC NDP convention, it was on contraception. But at the federal NDP convention, we presented a similar motion, and we actually withdrew our motion. There was a better one because it wanted free contraception and free menstrual products. And we were like, yes to those too, please. One of those, it's this weird kind of, it's a problem with the patriarchy where you can get free soap, free paper towel, free toilet paper when you go to a public washroom, but there aren't free menstrual products. That's very strange. And so when we reached out to municipalities, we're like, here's two things you can do to increase gender equity and gender equality and to promote reproductive health in your community: free condoms, free menstrual products. It doesn't cost much, but has a huge impact on people. If you're interested in learning more about the menstrual product campaign, check out the Period Promise. It's run by the United Way. And if you want to get in touch with them, I'm happy to send you the email of the person who's running it. It's a great campaign, mostly because people who lack access to menstrual products are missing school, they're missing work, and that's having a huge impact on their lives. And I'm sure folks know about the pink tax on products already, but if you don't know about the pink tax, the cost of menstrual products isn't a pink tax, it's an overt tax on a uterus. And we should try to reduce that as much as possible.
Okay.
And one last thing, just on the men thing. I always have to recognize I am, a white dude talking about these issues, and it's important that we step up and that everyone steps up and fights for equality. It benefits us all. But I've also found on the campaign that elevating the voices of other folks, getting out of the way and letting other people in the campaign talk has also been really important, because the team is amazing and diverse, and their lived experiences are obviously more compelling than my sort of drier statistics about access to abortion or access to menstrual products. And so we've had a lot of compelling narratives and stories being told on the campaigns from people who are abortion doulas or medical providers talking about the experiences they've had. And I want to end with one funny story for everybody, because this is probably my highlight of the campaign, second highlight of the campaign apart from the incidents during the last election. But we were tabling at the University of Victoria, and a woman, we brought a woman over to the booth, and she was signing one of our letters. It's an easy form to fill out online, accessbc.org. You can all write a letter today to John Horgan. And she's filling out a letter, and the person running the booth said, "Oh, your boyfriend, he should come over and write a letter too." And the guy's like, "Oh, no, man, no. Contraception's for women. I don't need to deal with this stuff." And the woman dumped him on the spot. She broke up with him right there on the spot because he refused to sign a letter for our campaign. And we thought, if our campaign comes to nothing, we save that woman for another minute with a relationship with a dud, with a guy that doesn't understand that equality helps everybody. So that was probably one of my highlights of the campaign. And yeah, I think a bit of a lesson to be learned for everybody right there.
Well, thanks so much, Teale, and thank you for your great questions. So as we wrap up our session, I just would like to remind you that you will receive a follow-up email with an invitation to fill out a survey. Your feedback helps us improve. So if you have a moment, please do so. And you can also suggest a speaker or a topic of interest to you. And finally, our third webinar on reproductive health will take place on the 20th of December, and we will have Dr. Srishti Huku. Please join us for a discussion on the new frontier of sexual and reproductive health, which is the artificial womb technology. So thank you all for being here today, and stay safe and connected, and enjoy the rest of your weekend. And thanks again, Teale.